bit. The governor mentioned, and I'm sure you've heard of some issues with lab turnaround time. I want to preface this by saying this is a national issue. This is not something that is specific here in Tennessee, but it is certainly affecting us here in Tennessee. We have heard of delays of 7, 10, sometimes even 12 days to get results back from a test. That's unacceptable. We can't get patients back to work. We can't get contact tracing started until we get that result back in. Let me tell you why that may be happening. There are a lot of reasons, chief of which is probably, remember, nobody did this test prior to February. So they went literally from 0 to thousands per day in 4 months. I know it's felt like 4 years, but it's about 4 months. And we've asked our labs to do a whole lot in a short amount of time. So that's one. They've just started doing this in the last few months. And another one is it takes time. Even with a desire, it takes time to scale up. So you've got equipment that you have to scale up. You've got supplies that you have to scale up, and personnel as well. And the supply chain has been, it's been fluctuating. You remember at the beginning of this, we didn't have the supply chain coming. Many of those supplies came from overseas, and with their shutdowns, that supply chain was interrupted. That has solidified, but now the demand is really outpacing the supply, and so these supply companies and as well as the equipment manufacturers are having trouble keeping up. So it's going to take some time to catch up with that demand because right now every single lab in the state and quite frankly in the nation is getting close to being maxed out on their capacity. So what are we doing about that? We have the ability to monitor lab turnaround time, and we routinely look at least several times per week at the turnaround time of 26 different labs that are used across the state. Some of those are out of state, most of them are in state, but we're watching that almost on a daily basis so we can direct samples to the labs that have the most capacity and the shortest turnaround time. We're also helping labs build capacity wherever they can. If they need guidance on where to seek supplies or how to get manufacturers to get them some equipment in a faster time frame, we're trying to do that for our commercial partners, and we're trying to build our own capacity in the state public health lab. And we're no different than any other commercial lab. We're relying upon the same supply chain, and so it's taxing us as well to build that capacity.